this leads nicely to the next question, which is, if I want to improve my morphology, what's the first thing I should do? What are some practical, tangible tips you can give to the listeners about improving their morphology today?
So here's the thing, with the morphology, it's not going to happen. Instead, it's the knowledge that you're going to be able to apply to every field of the dentistry that will massively improve the quality of your dentistry. Obviously, better quality of the dentistry, the happier patients are, the happier you are yourself, the happier the patient, the more patients you get, then you start earning a little bit more. So it's quite a slow process. However, I'm a firm believer that everyone is capable to learn that if you give them a recipe. So the way I teach the morphology is, it's not that I'll explain you how the upper left 6 is, and then you're going to go back to the practice and repeat it. I think there is a protocol that not needs to be followed, but it's better to follow in order to be more efficient. So the way I teach it, it consists of 3 steps. First, it's stupid simple, actually. First, you need to have the knowledge, meaning that you need to visualize the morphology. When you look at a particular tooth, you need to understand what is it exactly that you're looking at. We have to understand one thing, that our eyes are only going to recognize those features of the morphology that our brain taught us to see. As if, well, imagine very simply, if I know Brad Pitt and I bump into him on the street, I'm going to be, oh my God, I bumped into Brad Pitt, yeah? And then if I don't know Brad Pitt, I've never heard of him before, I can bump into him 3 times a day. It will not make a difference for me, right? So it's the same with the morphology. You look at the tooth, you have to understand what is it about that tooth that makes it right or wrong. What are these features that you're looking at? What are these cusps? Why are they there? What are they? Where the tips are, etc. So I think the knowledge and that visualization is a very important step. And this is what you do first. You get the books, you look at the pictures, you look at any courses that you may find online. You can read about it, but then you need to take an action from that. Now, imagine, Jazz, what would happen if I show you the same very beautiful, cute upper left 6? I can explain everything in detail about that 6 for you, and I tell you, now go and do that in the mouth. Would you be able to replicate that straight away?
No, of course not. I mean, surely one needs to practice and close your eyes, visualize it, and keep practicing. That's my guess and where you're going to go.
Exactly. So I think, practicing that on our patients, we do that inevitably. We practice that on our patients, but it's very difficult to be predictable and quick. So therefore, I think the step number 2 that is very useful and is very controversial and is very hated by dentists is when you start drawing the tooth. And I don't necessarily mean a very fancy drawing with shadings and colorings. It might be a very simplistic, very simple drawing where you repeat the same tooth over and over again. It allows you to make mistakes, correct them quickly, produce numerous amounts of the same drawing or different drawings on the same tooth, and learn how the human form is supposed to look like. So if you make a mistake, you can correct it. And what I mean by that is that, when you draw again and again, you teach your brain to recall everything that what you called like a knowledge when you were reading about it. It just trains your brain to recall, to reproduce all these features that is somewhere there in the brain. And finally, the third step.
What if you can't draw? What if like me, you can't draw? And that's a common objection you might get. So yes, number 1, you said know what the tooth looks like, and okay, so I can completely learn the anatomy of an upper first molar, the transverse ridge, visualize it, but then like when I'm drawing it, I look like I drew like a banana or something, like.
Oh, Jazz, you're not an artist. I thought you were an artist, so you're not. No, yes. I mean, it's a very common question that I get, or the remark that I get on the courses. And trust me, the eye rolling that I've seen on the course, like, oh, well, God, are we trying to become Picassos here or what? Well, if you don't want to be an artist, well, don't be. You're a dentist. You don't need to draw the tooth, for it to look very 3-dimensional. Drawing, there's a difference between the artistic drawing when you try to produce a piece of art, and there is a drawing as an exercise to learn the tooth morphology. And that is two completely different things. So me, for example, I can draw you a very realistic tooth, very three-dimensional tooth. Does that mean that I'm an artist? Jazz, you should look at my drawings. I mean, they are complete rubbish. I mean, you ask me to draw a horse, it will be a disaster. But I can draw a tooth because to me, drawing is very methodological. It's very logical. I follow a very precise sequence, thinking about the features of the morphology.